Hi, this is Dana Gardner, Principal Analyst at Inter Arbor Solutions, and you're listening to BriefingsDirect. Our next Intelligent Workspaces discussion explores how healthcare organizations are using the latest digital technologies to transform patient care and experiences. You know, when it comes to healthcare, time is of the essence and every second counts. But healthcare is a different game today. Doctors and clinicians, once able to focus exclusively on patients, are now being pulled into administrative tasks that can eat into their ability to deliver care. To give them back their precious time, innovative healthcare organizations are turning to a new breed of intelligent digital workspace technologies. I am pleased to be joined here today by two leaders in this area who will share their thoughts on how intelligent workspace solutions change the game and help transform healthcare as we know it. So we're here today with Mick Murphy, Vice President and Chief Technology Officer at WellSpan Health. And WellSpan Health forms an integrated healthcare system with more than 19,000 employees serving the communities of central Pennsylvania and northern Maryland. They consist of 1,500 physicians and clinicians, a regional behavioral health organization, a home care organization, 8 respected hospitals, and more than 170 patient care locations. Welcome to BriefingsDirect, Mick.
Thank you.
We're also here with Christian Boucher. He's Director and Strategist Evangelist for Healthcare Solutions at Citrix Systems. Welcome, Christian.
Thank you for having me.
Christian, let's start with you. There's a concept out there about precision medicine. It's an emerging trend, and it delivers patients' care specifically to treat illnesses, a bit more specialized and direct. So what is it about precision medicine in particular that has allowed intelligent workspace solutions to come to the rescue and help make that more successful?
Well, Dan, I think, the biggest part for us was when we really investigated precision medicine and understanding how intricate medicine was being delivered to the population, understanding that every individual is different. They have their own needs, whether it's on the medication side, whether it's on the support side, whether it's on the genome side. And understanding how physicians and healthcare in general is starting to identify better ways to treat patients and make it more of a customized experience, not only, in the clinical setting, but also when they get home, really helped us kind of formulate our concept of the intelligent workspace. And what we decided to do was really look at how users consume resources. As an IT organization, and I supported a healthcare organization for 12 years before joining Citrix, it was always our role as an IT organization to deliver resources to our users and how they needed to consume them. Not define how they utilize those resources, but identifying how and when they needed to access them and make it as simple and seamless as possible. So with, the intelligent workspace, what we're really looking to do is to deliver that customized experience to not only the organizations that deploy our solutions, but also to the users that are consuming it, the doctors, the nurses, being able to understand how they're consuming resources, where they're consuming resources, and moreover, being able to customize that experience in real time using our analytics engines and our machine learning to really preemptively deliver computing resources or applications or data in real time. So when it comes down to walking into a clinic, I understand that through our analytics engine, when I walk into this specific clinic, I utilize these 3 applications. So before I even walk into them, we can have them spinning up in the background to minimize that time to actual access. So every minute that we can subtract from that technology interaction is another minute that we can give back to our clinicians to actually work with the patients and spend real time with them.
Right, so more understanding the context, the actual patient, more detail. That requires bringing together lots of assets and resources on the back end, but in doing so, can be very powerful, targeted, and reduces the complexity for those people on the front lines. So Mick, WellSpan Health, has been out in front on this, trying to bring together this digital workspace technology for better outcomes. Tell us a bit about some of the challenges you faced. Why did you need to change the way things were?
So there are a couple of things that drive us. One is productivity and getting time back to clinicians so that they can focus on patients. So Christian mentioned a lot of things. There's a lot of value in information being brought to the clinical space. And the challenge with that is physicians, nurses interacting more with computers than with the patient. So we actually think about not minutes. We actually think in 9-second increments. So that may sound a little crazy, but what we talk about is a 15-minute visit with your primary care doc. That's 900 seconds, and if you think about 9 seconds is 1% of that visit. So we're looking to give back percentage points of a visit that a physician's not interacting with the computer, but they're interacting directly with the patient. So they quickly get the information that they need from the medical record, but then they're able to swivel and get back to focusing directly on the patient.
Yeah, it's interesting. It's almost ironic that you have to rely on digital technology and integration and pulling together disparate resources and assets in order to then move past interacting with the computer. So how is it that on one end we're doing more technology, but on the other end we're actually reducing the footprint of that technology when it comes to the patient and clinician experience?
I think optimally the technology actually tends to fade into the background. Many of us in technology, we'd like to have the attention, but at the end of the day, if the technology just worked, that's really what we're striving for, so that, again, it's back to that interaction with patients. Mm-hmm. So what are we trying to do there? We're trying to make sure that as soon as a physician wants something, that they get it. So part of that is the ability to quickly get into the medical record, for example. So an emphasis for us with the digital workspace was our old system, we were at 38 seconds to get to the medical record. So we were able to cut that to, our target was less than 7, but we actually got it to under 4. And some of that's what Christian was talking about. We know that when a physician walks into an exam room that they're going to need to get into the medical record. So what we do with our EHR is we spin up a 6-trick session in advance. We've already connected to the electronic health record, so all we're waiting for is who's that person that just walked in the door. And as soon as they drop their badge onto a reader, it tells who they are, and they're quickly into that electronic medical record. So they don't spend any time doing any searching and what applications do I need to run. All that's pre-decided for them.
So, Christian, having a better technology in the background, anticipating needs, operating in the context of a process, this is all fairly complex, but the better you do it, the better the outcome in terms of the speed and the access to the right information at the right time. Tell us a little bit about why intelligence and what goes on in the background is important to make that outcome better for the interaction between the physicians, clinicians, and patients.
For years, IT has gone through and worked with physicians and clinicians trying to identify ways to increase productivity, give time back to them to actually focus more on patient care. So really what we've tried to do is leverage newer technologies. When we talk about AI, we talk about machine learning, we talk about analytics, to really drill down deeper into what is actually happening. And not only on a generic physician workflow, but there's been times in the past where I've had to go in and assess physician practices as we were implementing new EHRs and new clinical applications or just new workflows in general. And, the first thing that popped into my mind is that, there may be 20 doctors here, but they all work differently. And they all have a certain preference in how they consume. They all perform at different levels depending on the technology that they're interacting with. Some doctors want to work with tablets and be able to jump screens from one to the next depending upon their specific workflow, where some are more comfortable working with full-on laptops or working on a desktop. So being able to understand how, not only understand, but also to be able to deliver an experience that the clinician can decide how is best suited for their specific work style is really key. If you go from one if you go from one floor to another floor in a hospital and watch how nurses, work differently from an ER to a NICU, the workflows are considerably different. So not only do we have to deliver those key applications, but we also have to be mindful of how each of those different groups interact with the technologies. And it's not just applications, it's not just EHRs, it's also hardware and software and locations. So being able to really not only deliver those experiences, but kind of predict in real time how they'll be consuming those really expedites the process for them to get back into the patient-focused arena.
That's a great point. You mentioned tablets. I don't know what it is about physicians, but a lot of their kids seem to swim. So a lot of our docs spend time at swim meets. And one of the things is, if you're on call and you're at a swim meet, you have actually a lot of time where your child's not in the pool. And one of the things was, giving that secure access. So, Dana, it's really important to us that we make sure that medical record is private and secure. What we're able to do now is, say, hey, grab your tablet, take it with you to the swim meet, and you don't have to leave the swim meet. You'll be able to stay at the swim meet, and if you get a call, you get paged, you'll be able to pop out that tablet, access the medical record. All of that access stays inside of our data center. All they're looking at is a pretty picture of what's going on inside the data center at that point. And so that prescription refill that's urgent, they're able to handle that there without having to leave and take time away from their kid. We're trying to improve the quality of life for our physicians as well, because they're under an intense amount of pressure with healthcare the way it is today.
As we look at how work is done, there is no predefined, workspace anymore, especially in healthcare where you have these on-call physicians. I mean, if you look at just business operations and remote coders and being able to offset internal resources for billing, work does not just get done in the hospital anymore. Now we are looking for ways to extend that same secure delivery of applications and data outside of our four walls, especially if you have 19 hospitals. So as you start looking at ways to find leverage points for organizations to be able to attract resources that may not fall inside the hospital walls, it's key for us to be a little bit more flexible in how we can allow organizations to deliver those resources outside the walls.
So, Christian, you nailed it when you talked about how adoption is essential. Mick, what sort of ability have you been able to bring with digital workspace solutions to help people want to use these apps, see them as productive, don't see them as an onerous sort of requirement on them to do work in a certain way? What's the adoption patterns been like now that you've been able to give them this flexibility and, in a sense, customize it to their requirements?
Our adoption's been pretty strong. Now, I'll be clear, it's required that you interact with electronic health records. So there isn't really an option to opt out. But what we have seen is that by making this more effective and fast, we've seen better compliance with things like securing workstations. Back to privacy, we want to make sure that electronic health data is protected. And if it's going to take me a minute to get back into context, well, then I'd be tempted to maybe not lock that workstation when I step away for just a moment. And then that moment can become an extended period, and that would be dangerous for us. So what we've seen is knowing that I'm going to get back to where I was in less than 4 seconds, and I'm not even going to have to do anything other than touch my badge to get there. We've seen that folks secure their workstations with great frequency. So we feel like we're safer than we were. So that's a major improvement.
And yeah, you just mentioned something else, Mick, about authentication. Is there something about the way that you're using workspaces that allows people to authenticate easily and have a common approach regardless of where they are, what they're doing, so they're not in this onerous process of passwords and logging in constantly?
Yeah, so we've combined a couple of technologies. So we use smart badges, and then those badges with a localized reader. So we have the readers scattered about for folks that touch multiple workstations. So myself, as an executive, I log into one machine, so I have to type my password. But for clinicians that are going from place to place, we have them log in once a day, and then as long as they're retaining their badge and they're getting back on, all they do is touch their badge to a reader, and it drops them right back into their workspace.
All right, so we began our conversation talking about precision medicine, but there's some other trends afoot now where transparency about the financial side of healthcare interactions is coming into play. We have new kinds of co-pays and co-insurance, and it's complex, and physicians, clinicians are asked more and more to be part of the financial discussion with patients. That requires a whole new level of integration and back-end work to bring that information in, but again, doing it in such a way that the adoption is strong, that people see these as useful tools. Anything about the need now to bring in new types and different types of information into this process? It's not just clinical information. It can be much broader. What do you think about addressing that, Mick?
That is actually a big challenge, and it's something that we are investing in. But we actually are extending on our website now where we let patients get on and say, hey, what's this going to cost? And what's this going to cost is usually a question with what the person really wants to know is, what's my out-of-pocket going to be? Well, and that's going to depend on that individual. So we haven't automated that end-to-end yet. What we've done is we've created a place where a patient can come on and say, hey, this is what I'm going to need to have done. Can you tell me what it's going to cost? And we actually can turn that back around. So we have to get a human being involved there, but we make that available either by phone or we actually now do it through our website.
So it's interesting, Christian, we're seeing now that the digital experience and the workspace experience in the healthcare process is now being directed back to the patient for a patient experience and digital experience. Is the intelligent workspace approach that provider organizations like WellSpan are using putting them in an advantageous position to now extend the digital experience to the patient wherever they are, as well as to, of course, clinicians and physicians?
Well, in some scenarios, we've actually seen some of our customers extend some of the Citrix resources outside to customers. A lot of EHRs now have patient portals that are part of their ecosystem, so we see a lot of customers leveraging that side of the house on the EHRs. But one thing that we understand is that regardless of the industry, the finance side, the back office side play a major role in how organizations operate. I mean, it's just as important to be able to get paid for something as it is to deliver care or to deliver any resources that your organization may deliver. So one of the key aspects for us was understanding how does this workspace transform over the next year, and some of the things that we're doing on our end is trying to look at those workflows. And we made an acquisition in the last 6 months from a software company that essentially creates micro apps. And what that really means is we may have processes on ancillary systems. They could be SaaS-based, they could be web-based applications, they could be on-prem installations of old client-server technologies. But what this technology allows us to do is to create these little micro experiences within the application. So, just say a process for verifying billing takes 7 steps, and you have to log into a system, and you have to navigate through the menus, and then you get to the point where you can hit a button to say, okay, this is going to work. What we've done is being able to take that entire workflow, maybe it's 10 clicks plus a password, and lower that down to not even have to sign into that application and create a little, we'll call it like a micro app that will actually go through that entire process and give you a prompt to do 1 or 2 steps. So every application that we can integrate with, and we have right now I think 150 or so that we're currently integrated with, but being able to take those workflows, which in some cases can take 5 minutes to walk through it, and turn it into a 30-second interaction with that technology. Our goal is to look beyond just the general workflows and be able to extend that out into these ancillary programs where you may have these kind of normal everyday activities that don't need to take as long as they do, and simplify that process for our end users to really optimize their workflows during the day.
Mick, reactions to that? This really sounds like moving in the direction of simplifying process and using sort of robotics and bots as a way of automating things, taking the time and compressing it and simplifying things all at the same time.
I think it's fascinating, and it sounds like a great direction. I'll be completely transparent. That's a future for us, but it sounds like I need to get with Christian after this interview at some point.
All right, let's revisit the idea of security and compliance. Regulations are always there. Data sharing is paramount, but protecting that data can be a guardrail or a limiter on how well you can share. So let's start with you, Mick. How is it that you're able to take that patient experience with the clinician and enrich it with all the data and resources you can, regardless of whether they're at the pool, at home, on the road, and yet at the same time have compliance and feeling strong and confident about your posture when it comes to risk?
We feel pretty good about this for a couple of reasons. One is, as I mentioned, the application is still running in our data center. So then the next question is, well, who can get access to that? So one thing is strong passwords, but as we all know with phishing, those can be compromised. So we've gone to multi-factor, and with multi-factor authentication, we feel pretty good about remote access, and then follow that up with, then once you have access, we're not letting you pull stuff down onto your local device. So you're just seeing what's on the screen, but you're not pulling files down or anything of that nature. So we have a lot of confidence in that approach.
Yeah, and just to build on that a little bit, we understand, again, coming from a healthcare background and seeing how our users are looking to consume the resources, security is always a moving target, and there may be certain situations when I am accessing technology and I have full access to do what I please. I can copy and paste out of applications, I can screenshot, I may be able to print specific records, but there may be some times within that same workflow but different work style where I may be remote accessing technologies. And those security parameters change in real time. So I know that now as an organization, I don't feel comfortable allowing user X to be able to print patient records when they are not on a trusted network or they're working from home or an unknown device. So we at Citrix understand those changing factors and understanding that our border now is the internet. If we are allowing access from home, we are now extending our resources resources out to the internet. So it really gives us a lot more to think about, and what we've built into our solutions is kind of this granular control built on our machine learning and analytics solutions. So we understand that when you access something from in the office, you have a certain amount of privileges as an end user. But as soon as you extend that same access outside of the organization, in real time we can flip those permissions and stop allowing users to print or screenshot or copy and paste between applications. And really that's invisible to the end user. That all happens on the back end in real time. So security is something that we take extremely seriously at Citrix, and we understand that our customers do as well. So giving them those controls allows them to be a lot more nimble in how they deploy solutions.
I agree with that. Another thing that we'd like to do is, as much as possible, we'd like to have technology controls that help people be safe. So a lot of this isn't about the bad actor. It's about somebody that's just trying to do the right thing, but they don't realize the risks that they're taking. So we would like to put technology safeguards in place. So, you're working at home, you're going to have some guardrails around you that are tighter than the guardrails when you're standing in our hospital.
All right, let's revisit one of our core premises today, which was this notion of giving time back to the clinicians, to the physicians, to improve the patient experience and outcome. Do you have any other examples, Mick, of how having an intelligent and digital workspace solution environment helps you give that time back? Are there other ways that you're seeing the improvement in the quality of care and the attention span that can be directed at that patient and their situation?
Yeah, one of the things we try and do is we talk a lot in healthcare about working at the top of your license. So we try and push tasks to the least skill level needed in order to do something. So when you come in for a visit, rather than having the physician look up your record, what we do is we have the medical assistant that rooms you, brings you in, asks why you're there that day. They open the record, they ask you a few questions, they get all that in place. Then they secure the workstation, so it's locked. And then, so when the physician walks in, again, we drop the badge, and now not only am I in the electronic medical record in 4 seconds, I'm in Dana's record. So now here's Dana, he's sitting in front of me, and I can just immediately turn to you and say, hey, how are you doing today? What brings you in? And we can just go right into our conversation. So again, the technology tease everything up so that my focus can be on you as a patient if I'm the physician.
And I appreciate that, because the last thing I want to do is fill out another blank clipboard, telling them my name, my age, date of birth, and the fact that I had my appendix out in 1984. So, I don't want to do that 4 times a day, but it's so great to know that the information now is going to follow me across that process.
And Dana, you're better than me because I had a tonsillectomy in any of 82, 83, 84. It depends on which time I answered the survey, right?
Yeah, I think as we look forward a year or 3 years or 5 years, that tighter integration between the technologies that our clinicians are using to access and the actual systems are going to become, I would say, more intertwined. We start talking about spatial computing and these interfaces between doctors and EHR systems or inventory systems, where spatial computing can become more of a real-time factor in how care is delivered. And this is just some of the things that we're talking about in our labs and understanding how workflows are creating. But imagine being able to walk into a room with no more than, let's just say for happenstance, an iWatch or an Apple Watch or a smart watch that I have on my wrist that's essentially carrying my passport, and being able to utilize proximity-based authentication into those systems and interact with technology without having to log in and do all the multi-factor authentication. And then take that a step further by having these interfaces between the technology in the room and the EHRs and your bed flow system. So as soon as I walk into a room, I no longer have to navigate within the EHR to find out which patient is in the room by them being in the room and interfacing with BedFlow, or having a smart patient ID badge, being able to automatically navigate to that patient in real time. So in reality, I am trying to remove all of that administrative tasks from a clinician workflow, and just having, whether it's IoT-based devices or smart devices in rooms, being able to kind of complete half of that workflow for you before you even step in. And those are some of the things that, as we look at our intelligent workspace and our micro app design and our interfaces into, different applications, those are the kind of the ways that we see our solutions being able to help clinicians and organizations deliver better care.
Right. I think you're pointing up also in the future, Christian, that there's going to be more and more data. It's always increasing, whether it's genomic information, a smart device that's picking up actual tracking information about an individual's health and making that available, more information available across different types of diseases and the protocols for addressing them. So I guess the last question to you, Mick, is that we're facing more complexity, more data, more information. That's great because it can help us do better things in medicine, but it also needs to be headed off because it can be overwhelming. Maybe we can close out with an idea of, as more complexity and information becomes available, what steps should we be taking along the way so that becomes useful and actionable rather than overwhelming?
Well, I think this is a real opportunity for artificial intelligence around an actual smart clinical assistant. So something that's helping cull through all the data. Here's this genomic data, here's this drug-drug interaction, and really identifying what's most important to get that human judgment on. And so it's teeing up. These are the things that I think you should look at versus, here's all the possible things you could look at. Here are the things that you should really focus on or that seem most relevant. So really using computing to assist clinicians rather than tell them what to do, but at least help them with where to focus.
Yeah, and Christian, just to follow up on that, where would that AI exist? Is that something we're going to be putting into the doctor's office, or is that going to be something obviously back perhaps in a cloud or multiple clouds or multiple data centers? How does AI manifest itself to accomplish what Mick just described?
Well, I think that, as of now, it's really AI leverages intense computing power. So we're talking about significant resources internally. While we do see some organizations trying to bring these quantum computing-based solutions into their organization and leveraging that, what I see, is probably more of a hosted solution at this point because of the expense, but also because of the technology. When you start talking about distributed computing and being able to leverage multiple input solutions, you talk about an Epic or a Cerner, I'm sure that they are working on technologies like that within their own solutions, or at least that allow their information to be shared within that. So I think we're kind of in the infancy of that trend, but as we go through, we'll see more and more technology play a factor in that, and we could see some organizations partnering together to build out solutions. So it's hard to say at this point, but what we do know is there's a lot of traction right now, and unfortunately they are mostly high-tech companies trying to leverage their algorithms and their solutions to deliver that, which at some point I would guarantee that they'll be mass-produced and ready for purchase.
AI could be everything from learning to just applying rules. Some might not classify that as AI, but I would say it's very rudimentary AI. We have a rule set that we run an algorithm for sepsis, and what that enables us to do is monitor a variety of things about a patient, vital signs, lab results, various data points that are difficult for any one human to be looking at across the entire set of patients that are in our hospitals at any given time. So we have a computer watching that, and what that does then is when certain criteria are met in this algorithm, it kicks it to a centralized team that's staffed with nurses, and the nurses look at that individual patient then. They hone in on that patient and say, does this look like a false alarm, or does this look like something that we really need to pursue? And based off of that, they send someone to the bedside. And we've had dramatic improvements in sepsis, and where our observed to expected is now much lower than benchmark. So there are some really easy technical things to do. But you have to engage that then with human beings and get a team involved and make that happen.
These intelligent digital workspaces aren't just helping cut time. They're going to be that front end to help coordinate some of these advanced services that are coming down that can have a really significant impact on the quality of care and also the cost of care. So that's very exciting. I'm afraid we'll have to leave it there. We've been listening to a sponsored BriefingsDirect discussion on how leading healthcare organizations are using the latest digital technologies to transform patient care and experiences. And we've learned how doctors and clinicians are turning to a new breed of intelligent digital workspace to gain a consistent and contextual user experience and therefore better healthcare outcomes. So a big thank you to our guests. We've been here with Mick Murphy, Vice President and Chief Technology Officer at WellSpan Health in Pennsylvania. Thank you, Mick.
Thank you, Dan. I appreciate the opportunity to be here.
And we've also been here with Christian Boucher. He's Director and Strategist Evangelist for Healthcare Solutions at Citrix Systems. Thank you so much, Christian.
Thank you for your time. I appreciate the invite.
And a big thank you as well to our audience for joining this BriefingsDirect Intelligent Workspaces discussion. I'm Dana Gardner, Principal Analyst at InterArmor Solutions, your host throughout this series of Citrix-sponsored BriefingsDirect discussions. Thanks again for listening, and do come back next time.